Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have a special episode for you tonight. We're talking about the COVID-19 vaccine, as well as innovative treatment options for COVID patients. We'll be joined by a panel of professionals who are on the front lines and leading the charge as St. Luke's continues the rollout of vaccines. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at COVID-19 vaccines with St. Luke's University Health Network. Stay tuned. Thanks for joining us. Let's get started. We have an impressive panel of guests joining us tonight. Up first, we have Dr. Jeffrey Jari, the Senior Vice President of Medical and Academic Affairs and Section Chief Emeritus of Infectious Diseases. Dr. Jari is board certified in internal medicine and infectious disease. Dr. Jari has been with the network since 1978 and is also the host of St. Luke's award-winning television program, Talk with Your Doctor. Dr. Jari, thanks for being here tonight.
It's my pleasure to be here, Ashley.
You were among the first St. Luke's employees who received the vaccine. How did you feel after? Did you have any side effects?
I looked forward to this with a great deal of excitement, and there's also a little bit of anxiety or trepidation because there are some unknowns that are associated with it. But there was no doubt in my mind, being in the kind of risk groups that I am and someone who actually treats COVID patients, that this was the right thing to do. And I found that the whole process was very smooth because I was one of the first people. I did it in front of an audience, which is not the usual situation for most people. But I found that I think the best way of actually looking at it is to say it was no big deal. And the only side effect that I experienced was some soreness over the site where I got the vaccine. And I think, as anyone knows who's ever received any vaccine, that's not an unusual situation. There's nothing that has happened that we could say is truly out of the ordinary that would dissuade an individual from taking this vaccine.
Joining us next, we have Dr. Denny McGorry. Dr. McGorry is the Senior Regional Medical Director of the St. Luke's Physician Group and practicing physician at West Allentown Primary Care. He's board certified in family medicine and has been with the network since 2009. Dr. McGorry has been an integral part of the St. Luke's response to COVID-19, spearheading the setup of the network's testing sites and respiratory clinics. Thanks for being here, Dr. McGorry.
Thank you for having me, Ashley.
When you first got started in the world of medicine, did you ever think you would experience a pandemic?
Well, I think when you get into medicine, you have to be aware of history, and you know that history does repeat itself. So we do know over mankind's history, we've had episodes like this. So certainly wasn't very happy that we all had to deal with this, but I think it's something as far as being involved in medicine, we have to be prepared for. I will say that the team at St. Luke's has done a fantastic job rallying. We pretty much changed the way we operated overnight back in March and April, and continue to do so with a healthy dose of virtual visits, in-person visits. It's been humbling, it's been frustrating, but at the same time, it's been really amazing to watch the team through our network really rally together and come up with strategies. And I'm just proud to be part of this effort.
Our final guest joining us this evening is Tracy Arnold. She's the Director of Vaccine Management at St. Luke's. She graduated summa cum laude with her BSN RN from Cedar Crest College. Tracy has been with the network since 2013 and was recently a recipient of the Hospital and Health System Association of Pennsylvania's In Safe Hands Award. Great work, Tracy. Thanks for being here.
Thank you for having me, Ashley.
When you and your team first heard that a vaccine was so close to coming to market, how did you respond and what did you discuss to figure out the distribution and the management of this vaccine?
Well, probably I think the most important thing we did was acted early. We didn't wait until we knew that a vaccine was imminent. We started planning several months before we knew that it was coming. We pulled together a very diverse team of subject matter experts, ranging from clinicians to purchasing to information technology and operations, many departments that are too many to actually name. And we started planning for the arrival of the vaccine. We also began collaborating very, very closely with both the Pennsylvania and the New Jersey Department of Health partners to plan for that allocation across our network. It was a very diverse, very large, probably the largest operational function that I've ever been involved in. It was quite extensive, but also quite rewarding. We really pulled together as a team.
Unbelievable information. Thank you all for sharing your vaccine expertise so far. Next, we'll learn more about the timing of the vaccine, who should receive it, and the rollout plan moving forward. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
Vaccines are an important tool in the prevention and spread of diseases like COVID-19. St. Luke's is ready and prepared to receive the vaccine. The Centers for Disease Control has identified who will get the vaccine and when. This helps ensure that the people who need it most will receive access to the vaccine first. Continue to do your part. Be smart, social distance, and wear those masks. Together, we can stop the spread. For updates, visit sluhn.org/vaccine.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our panel for joining us and to our viewers watching tonight. If you're just tuning in, we're joined by Dr. Jeffrey Jari, Dr. Denny McGorry, and Tracy Arnold. We've started to discuss the basics of the COVID-19 vaccine, and now we're going to talk about the timing and the rollout plan to the general public. Dr. Jari, let me start with you. When did St. Luke's first receive the vaccine, and how have things been going with rolling it out to different groups? Who was up first?
Well, the first people to get the vaccine are the people who are in so-called Group 1A, and that is frontline providers. And we were very successful in getting it out very early to all of our frontline providers who actually accepted the vaccine. Secondly, we were also out front in sharing this with our community. We know that there are many independent practitioners. We also had our EMS people who were truly very frontline involved, and we are giving it to other healthcare workers such as dentists and their office staff as well. So I'm proud to say that the process, because of the smooth flow and the organization of the St. Luke's network, we were able to do this in a very, very efficient manner and continue to do that.
Well, you mentioned those frontline workers, and Tracy, why is it so important that healthcare workers, EMS providers, nursing home employees and residents, why should they be the very first that receive the vaccine? Why is that so important to the rest of us, really?
Well, healthcare workers and EMS, they continue to be on the front lines during this pandemic, which really increases their risk of exposure. So it's important to vaccinate healthcare workers and EMS to reduce that risk, but also so that we can maintain the ability to have a strong workforce, healthy workforce, so that we're able to provide healthcare services to all of our communities. We still need to provide care for patients, and without having a protected staff and a healthy staff, we're not able to do that.
That's an excellent point. And I know that from those of us watching it happen, there was so much excitement and hope around that. So Dr. McGorry, the question on everybody's mind is, when will your patients see this? When will it be available? And who's up next in the second group? What's the second wave? What can we expect?
So 1B will be the higher risk individuals, age 75 and up. And it really is the $1 million question: when will everyone be getting this vaccine? So the next wave, when we talk about general population, I think we're probably looking at realistically early spring, April or May.
Well, certainly as excited and as anxious all of us are to get it, it's important to follow the guidelines and do it right. So Dr. Jari, why are you encouraging people to get the vaccine when it becomes available to all of us? What's the message you're giving out there?
The message is simple, and that is that COVID-19 is still with us. It is a devastating disease in many people. It clearly alters people's lives with many complications and unfortunately results in a great mortality among vulnerable populations. When you look at that and the fact that it isn't about to disappear, in fact, there is now evidence that we have a strain that might even be more infectious that's coming our way, that's been seen in Great Britain as well as in South Africa. And we know that it's in this country. That is likely to become the predominant strain and cause us many different issues. The good thing is that no matter what the strain is, it is susceptible at this point to the vaccine. So prevention is always better than cure, no matter what we're dealing with, and that certainly applies to COVID-19.
Absolutely, and so well said. You know, Tracy, I want to turn to you because this distribution and the logistics around it cannot be simple. And Dr. McGorry mentioned what a great job your team is doing. Can you tell us a little bit about how it works behind the scenes? How do you even get people scheduled?
We start then by either direct communications. When it was with our employees, we reached out to those employees, gave them the ability to schedule their appointments directly online. We opened very specific clinics at all 11 of our campuses so that our employees had adequate access without being too inconvenienced to encourage uptick of the vaccine.
Well, it sounds like an incredible job that your team continues to do every day. So we thank you for that. Dr. McGorry, I know that we are concerned as we continue to see people get sick and die with COVID, but the positive news is that so many more treatment options have become available. Can you tell us a little bit about some of the new treatment options available at St. Luke's and kind of the role the pharmacy has been playing in that?
Sure. One of the treatments we've been pretty aggressive about pushing out onto the outpatient population is what's called monoclonal antibody treatments. And that has been the first treatment that we can actually prescribe as an outpatient physician. Our pharmacy staff has done a great job keeping supply, working closely with the Pennsylvania and New Jersey Department of Health to keep our supplies high. We have a process in Easton as well as in Warren, New Jersey, where we're infusing these patients. So we're starting with the highest risk patients. So we're looking for patients that are age 65 and up, and also those and or have a BMI above 35, which we know are the highest risk patients. The studies have shown that you can decrease a person's potential for progressing and requiring further medical visits and even hospitalization through these treatments.
There is so much information out there about COVID-19 and the vaccine, it can be very overwhelming. So thank you for your expertise and information thus far. Up next, we'll take a look at professionals from the pharmacy and learn about their role with monoclonal antibodies treatment as well as the vaccine. Stay tuned.
I do a little bit of everything at St. Luke's. I help to develop our clinical pharmacy program and oversee the clinical work that our pharmacists do. I also help manage inventory and drug selection for the entire network. I think my initial reaction to when COVID hit the Lehigh Valley was the same as most people. I was nervous and I was scared. How is this going to impact me? How is it going to impact my family? But at the end of the day, my mind went right back to my work, and it was how are we going to help all of the patients in the Lehigh Valley stay safe? And for those patients who do get sick, how are we going to help them recover? I think that the future looks really bright with the vaccine. We look forward to getting our continued shipments. We look forward and we're making plans for how we can start to vaccinate the next tier of people that have been identified by the CDC, those essential workers, and are also making plans for how this vaccine becomes available to the public through our various offices and the hospitals to really help protect everybody from COVID-19. As a pharmacist, the vaccine coming to us as quickly as it has been absolutely amazing. We are helping our nursing colleagues by drawing all of the vaccine doses up into syringes so that they are able to just administer it to the patient right then and there. Pharmacy has played a really instrumental role, not just in procuring vaccine and storing the vaccine, but making vaccine and other treatments like monoclonal antibodies and remdesivir available to our patients who are sick with COVID-19. It's been a very, very busy time for us as a department and an opportunity for our department to really show how we can play an integral part in taking care of our patients and really having the ability to shine doing what we do best, which is making medicines for patients. The monoclonal antibody treatment is actually administered to patients who have tested positive for COVID, who are in the early course of their symptoms, and it works to help your body fight the COVID virus itself from infecting your cells. It actually targets the spike proteins on the outside that help it infect your cells. And so what I would recommend to anyone if they are COVID positive is to reach out to their primary care provider to see if the monoclonal antibody treatment is something that might be beneficial for them and to talk through what that might mean for their care. I love being a pharmacist. I get the ability to impact patient care every day. I get to make a difference in the lives of our patients, not just during a crisis like this, but every single day. I love everything that we've been able to do here at St. Luke's to provide the best care for our patients, to give them opportunities to receive these new emerging therapies to help treat COVID-19 and prevent it in our community.
It's incredible to see how hard the pharmacists have been working behind the scenes during this pandemic. Now I want to talk about the efficacy of the vaccine. How well does it work? What are the different brands? And what's available to us? So Dr. Jari, I'm going to start with you. There are currently 2 different vaccines available, one from Pfizer and another from Moderna. Can you tell us how they work to fight this disease? Are they similar?
First of all, let's talk about the similarities of the 2 vaccines that are currently available, and that's Pfizer and Moderna. They both utilize a technology known as messenger RNA. And it's important for folks out there to know that that's not really a new technology. Both of these vaccines rely on the concept that the messenger RNA actually sends an instruction sheet to our cells to make something known as a spike protein, which is the attachment tool that the COVID-19 virus uses to get into our body and infect our cells. The difference is what the messenger RNA does is it produces a harmless variant of this attachment. And then our body doesn't know that, and it produces an antibody against that, which will also act against the harmful COVID-19. So it's very ingenious. It works very well. It does not utilize a whole virus. There's no way that you can get COVID-19 from the vaccines that use this technology. They both require 2 injections, but in the case of Pfizer, it's an injection that is 3 weeks apart. And in case of Moderna, it's 4 weeks apart. And as of right now, if you get either Pfizer or Moderna for your first injection, you need to follow up with that exact same vaccine for the second injection. We know that when you do this, that it seems to have a tremendous effect, that it may be as high as 95% effective, which is absolutely staggering when you think about it. So again, this is an effort that has been brought about by modern technology. There are at least 3 other vaccines that are in late stage development that use different technologies. The next one that I think we can look forward to is likely to be Johnson & Johnson, which uses a type of virus, an adenovirus, as a vehicle to carry into our bodies a pattern that tells our body to produce antibodies that will not be just active against that adenovirus, but against the harmful COVID-19. The interesting thing about the Johnson & Johnson vaccine is that it will very likely be approved as a single dose as opposed to 2 doses. And I think there's every reason to believe that it's likely to start to come out in about 6 weeks. The likelihood is in the next few months, we're going to have 3 effective players that will be available to us.
That was such an excellent explanation, Dr. Jari. Thank you so much. And Dr. McGrory, I'll turn to you because you're often on the front lines receiving those calls and having those appointments with patients and hearing their concerns about this vaccine. It is incredible science, incredible technology, but how does messenger RNA work? And what are the benefits of this type of vaccine? How is it different than, say, the flu shot?
Well, to Dr. Jari's point, the technology is not brand new. The messenger RNA technology that we're utilizing in these first 2 vaccines is absolutely amazing when one reads up on it. It's very safe. There have been some concerns about individuals feeling that this may incorporate eventually into their own DNA. That's absolutely impossible. It's an extremely safe way for the body to make its own antibodies to, as Dr. Jari mentioned, a benign segment of the COVID virus, which prevents these COVID viral particles from entering our cells and causing the ongoing illness. This is our ticket to get through this process. And Dr. Jari mentioned already that the prevention is the best way to get through this. If we can prevent this disease from infecting our society, we're going to move past it. And the vaccine is the way to do that.
Tracy, I'm going to turn to you. How do people know when it's their turn? Where do they go? Is there a cost associated? And how will they find out, am I up next?
St. Luke's, our team has done a very good job of putting together a website That's accessible by both external and internal clients, and they can go to that website. There is where we put our most up-to-date information. Again, we will be following the recommendations of the Pennsylvania, New Jersey Department of Health as we move through these various phases, but we will do that as quickly as possible so that we can vaccinate as many people as possible. The goal of mass vaccination is to rapidly vaccinate the maximum number of susceptible people. So in order to get to that end, we have to follow those processes, and we will do that. We will continue to do that. In terms of cost, you mentioned that the federal government is actually providing this vaccine free of charge to vaccine providers. Our taxpayer dollars actually funded this effort, and St. Luke's will not be charging any associated administration fees with this vaccine. So the vaccine is completely free of charge. There should be no income limitations, anything like that for any patients to be getting this vaccine.
Well, that is fantastic news, Tracy, and it sounds like all we need to do is just be alert and be aware and be ready. So thank you for that. Now we're going to take a look at a patient's story through her diagnosis of COVID-19. Stay tuned. You're watching St. Luke's Health Now.
My name is Michelle, and I was diagnosed with COVID in November. I was extremely tired. I had felt aching in the lungs. I did get shortness of breath. The reason I went to get tested was simply because in order to go back to work, I had to be tested. So I, at that point, contacted my physician, and she then said, well, we'll send you because they are requiring it. I certainly didn't think that I had it. I really thought I just had some type of ailments. I didn't feel on death's bed at that point. I just was very, very lethargic, very short of breath.
Michelle is one of my patients. When she was first diagnosed with COVID, I did offer her the monoclonal antibody treatment because she did meet the criteria. It is designed to help your body build antibodies to the virus. So you would essentially recover quicker from the disease process.
I was one of the first 3 people to receive the infusion in the Lehigh Valley as St. Luke's offered it first. It was exciting and scary at the same time. I only had to go one time, and it was about 4 hours, and you're taken care of very well. From there, I returned home. I felt better after resting that time, and things started to improve.
She tolerated the infusion well. We did a follow-up visit the next day, and she is doing fabulous.
After going through this whole experience with COVID-19, I feel much better, back to normal. And I'm very grateful to all of the nurses, physicians, especially Dr. Shikari and St. Luke's for helping me through this.
Being diagnosed with COVID is very scary for a lot of patients. They don't know what to expect. And to see somebody like Michelle get this outpatient infusion and to do so well and feel great is a great feeling. And it just makes me feel like we've done such successful and amazing things here at St. Luke's. And it just shows how amazing our network is to be able to pull something off like this. I've been St. Luke's proud, and I will always be St. Luke's proud.
Throughout the pandemic, you have done your part to fight COVID-19, but the fight isn't over yet. Remember to be smart. Practice social distancing, mask up, avoid crowds, remind others politely, and travel wisely. I know you're tired, I know you are ready to be back to normal, but it's important not to let your guard down. As a mom and as a physician, I'm definitely planning to get the vaccine when it's my turn. We are all in this together. Stay safe, stay healthy, stay smart.
St. Luke's is ready for you. We're working tirelessly to make sure our hospitals and facilities are as safe as ever. We're all masking for you, and we provide masks to our patients and guests. We're ready for you, screening all patients for symptoms before appointments and offering virtual registration and check-in. We're limiting the number of people in our waiting areas and repeatedly disinfecting waiting and exam rooms. St. Luke's is ready for you so you can stay healthy, now more than ever.
Welcome back. You're watching St. Luke's Health Now, and I'm your host, Ashley Russo. Thank you to our panel for not only being on the front lines of this pandemic, but for joining us to talk about the vaccine and what we can expect in the future. You know, Dr. McGorry, as we look at many more months of facing COVID-19 and until many more people are vaccinated, what does the new normal look like? How important are some of the precautions that we've adopted as everyday life, wearing masks, washing hands, social distancing? How important do those become in life after COVID?
It's probably important to try to decide what is life after COVID. And I don't know that we're there and able to define when that will occur. I know for the foreseeable future, we're still recommending individuals that have had the vaccine or even have had COVID to continue to mask. I do think this will be a shift in the way we encounter each other for quite some time. For the foreseeable future, we'll be wearing masks. We'll be aggressively hand washing. I think it's important to understand that a COVID vaccine for one person protects one person, but when you vaccinate the society, you protect the society. So as we have more people recovering from COVID and more people that we're vaccinating, you start to develop what's called herd immunity. So you start to eradicate the virus from the community. And that's the key. And that's why it's just so important for all of us to get vaccinated so that we can define and find what the new norm is once COVID has eventually left town.
Tracy, you've been dealing with this long before it was something all of us were talking about and thinking about. What's been your biggest takeaway of this experience, both individually but also as a part of the team at St. Luke's?
I honestly have to answer that as a team approach, because both individually for me, the collaborative efforts that we've done in our network has been outstanding. And the takeaway from that is we have been faced since March, even a little bit before that, with some very paramount tasks that we've stood up to. We collaborated, we worked together as teams, and we've done some very non-conventional actions to protect our patients, to move forward with things, to treat our patients. So my takeaway is the collaborative effort of this. It takes a village. It really does. And that's what we did here at St. Luke's. That's one of our mission goals, and we stood to the challenge.
It's so wonderful to hear that. And Dr. Jari, I'm going to turn to you for a closing word. You're such a gift to St. Luke's and to our Lehigh Valley community. Can't think of a better person to have been in pole position during this time. And I know that we are all very grateful to you. So I just want to ask for you for some closing words as we tell the community how important this vaccine is and how important these restrictions are, just to follow through to get us all safe and over that finish line.
The best thing that I can say is that no effective weapon is useful if it is not being used. And so the major message is the vaccine is available right now to limited individuals, but shortly it will be available to everyone. And we really can't stress enough how much encouragement we have to give people out there to do that. The second message is that unfortunately, it isn't like a light switch. I think Denny already mentioned that this is not the end of the war by any means. And in fact, what it does take is either 5 or 6 weeks, depending on which vaccine you're getting currently, in order for you to have full protection. And at that point in time, there are still going to be 5% of individuals who will not receive full protection, because we know 95% isn't 100%. So this is not the time to give up all the things that we do know that work. And we've mentioned that over and over again. And we're talking about masking, we're talking about hand hygiene and social distancing. So whether you get the vaccine or whether you don't, we can't give those things up. And that's what's very important for everyone out there to keep in mind.
Thank you all for joining us this evening, for making it so clear as to what we're in for, what we can expect, and giving us that hope that we do have the weapon now to fight COVID-19 with this vaccine. So I really appreciate all of you and your time. Thank you. For more information on the COVID-19 vaccine at St. Luke's University Health Network, visit their website at sluhn.org/vaccine or call the vaccination hotline at 1-866-ST-LUKES, option 7. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for watching. Until next time, be well, and remember, it's important to focus on your health now.